DBT stands for Dialectical Behavioral Therapy. What does even dialectical mean? And so dialectical is kind of like the synthesis of opposites. Two points of views coming into the middle. DBT addresses and treats extreme emotional intensity, a combination between kind of traditional cognitive behavioral therapy and Eastern philosophy. And that Eastern philosophy is like meditation, self-acceptance, walking the middle path, blended in with cognitive behavioral therapies such as kind of looking at your thinking, how your thinking impacts your emotional experience, looking at kind of like your environment. So it's kind of a combination of the two. Really, DBT has revolutionized therapy. It really helps make that bridge between being kind of like the immature kind of child thinking to becoming a young adult and moving into the world of being effective. So the underlying philosophy of DBT is finding the middle path. It's finding that balance in one's life. It also includes finding balance in one's relationships, which means relationships with ourselves and relationships with other people. It calls on us to accept reality while maintaining a strong commitment and conscious commitment to change. I really believe when it comes to depression, anxiety, and a lot of things is that it really is about managing your emotions effectively. When you're in an emotional place, our minds naturally go to black and white. And so the dialectical philosophy of DBT really teaches the individual and also the therapist too about looking at that kind of black and white thinking, trying to find the middle path, trying to find the balance in things. So DBT was originally developed to work with borderline personality disorder. It's also been modified to work with lots of other things, such as eating disorders, substance use, self-harm, and anger management. It's just a few of the actual diagnosis and issues that DBT addresses. There's 4 core areas of DBT: mindfulness, distress tolerance, interpersonal effectiveness, and emotional regulation. First off, mindfulness teaches the individual to learn how to tolerate and experience being in the moment, even during times of unpleasant emotions, and to deter from using unhealthy avoidant behaviors to deal with these feelings. One thing I really noticed is that everybody's different. And we'll have some girls that come in are very emotionally reactive, you would say. We have also girls that are kind of really cut off emotionally, and they use a lot of intellectualization, and they kind of use logic to deal with how they're feeling. When you're very logical, you leave out the emotional part, and you're leaving out a lot of information that can be helpful about relationships or knowing about yourself. And both are really important. So the key is really trying to find balance. Basically, mindfulness is a vehicle for balancing our emotional mind and our reasonable mind, which is wise mind. The way I look at emotional regulation is, what are the things we have to do on a daily basis to take care of ourselves emotionally? I really believe that being happy and experiencing pleasant emotions is just not handed to us. It's something we have to work towards. And we have to take care of ourselves. Think about like what we do to keep ourselves healthy physically. We sleep well, we eat well. We need those same kind of skills to keep us emotionally healthy. Some of the emotional regulatory skills that really stand out to me, I think are very helpful, and there's quite a few of them. For example, is just learning how to identify how you're feeling. And research has been proven just identifying how you're feeling is actually more than half the battle. Just being aware of what you're feeling will actually give you the necessary skills to manage what you're feeling. Another critical emotional regulation skill is just actually identifying obstacles that get in the way to changing your emotions. One of the big skills that the girls really love is acting opposite to current emotion. That's another really big emotional regulation skills. And then another one too is that, you know what, you have to be building positive emotions. If you have a bigger bank of positive emotions, then when a negative emotion comes along, you can deal with it a lot more effectively. Interpersonal effectiveness teaches setting boundaries, holding limits with other people, being assertive in your relationships. One of my favorite interpersonal effectiveness skills is actually identifying what you want, identifying how you want the other person to see you, and also how do you want to feel about yourself. And so it's really important to be mindful of those 3 different goals when you're interacting with people. A lot of people who struggle with their emotions also struggle with relationships. That up and down, the lability in their emotion has really kept them from developing the necessary skills to deal with their relationships. So interpersonal effectiveness helps the individual to actually get their needs more effectively met. It's really important to teach the emotional skills. It's also really important to teach the skills how to deal with relationships, because when it all comes down to it, It's all about relationships. I kind of think of distress tolerance skills as like a paramedic. When a paramedic rushes on a scene when somebody's injured, are they necessarily trying to like solve the problem? All they're trying to do is stabilize that patient. So DBT, distress tolerance skills, actually teaches you how to stabilize yourself. You're not necessarily kind of solving the issue that's making you really upset. You're just actually trying to lower your anxiety, lower your emotions so you don't make the problem worse. So most approaches to mental health treatment focuses on changing these distressing events. But sometimes just learning how to accept them is actually a more effective way to go about doing it. We all have days when we feel really overwhelmed, and what do we do in the moment? I can think of a time where I was actually interviewing for my job at Sunrise, and I was on the way, and I got a flat tire. And I was pretty upset. I was like, oh my gosh, I'm gonna be late for my interview, what do I do? So if I approached changing that tire being too overwhelmed, I think I would have maybe stripped a bolt or might have hurt myself. So I had to really pull away and just had to actually take a few breaths and use my own distress tolerance skills to go back and actually solve that problem of the flat tire. Unpleasant emotions are just a normal part of life. I think we forget about that a lot. Non-acceptance of pain leads to suffering. In a nutshell, distress tolerance skills really helps the individual learn how to self-soothe and use their 5 senses and turn the mind to actually self-regulate. And then once you self-regulate, then that's when you go back to solve the problem. I really believe that we have emotions for a reason, and they teach us things. And be able to sit in our emotions and to learn from them can actually provide us great information to what to do or what's really going on with us. DBT is a proven method to treat individuals that struggle with emotional dysregulation. But also too, it provides the necessary skills and approaches to tackle life's challenges and interpersonal struggles.